Tonight, News Channel 11 is in your corner asking the top executive of Ballad Health questions you want answered regarding the recent changes to Tri-Cities trauma centers and the pediatric NICU unit in Kingsport. With that, we welcome you into News Channel 11 at 5:30. I'm Sarah Diamond. Last week, Ballad Health announced changes in the Tri-Cities regarding trauma centers. Holston Valley Medical Center in Kingsport is currently a Level 1 trauma center. It will become a Level 3. Bristol Regional Medical Center is currently at a Level 2 trauma center. It will also become a Level 3. Johnson City Medical Center will maintain its status as a Level 1 trauma center. Some other important changes: pediatric emergency rooms will be added to Holston Valley and Bristol, while the first pediatric trauma center in the region will be added at Johnson City Medical Center. Ballad Health CEO Alan Levine joins us tonight in the studio with Josh to talk about all of these changes and explain why they're happening. Josh?
Sarah, thank you very much, and thank you, Alan Levine, for being here in an extended time. We're going to take a moment to go a little deeper than we've been able to go on an issue that's been of big conversation throughout the region over the past few days. So thank you for your time ahead tonight.
It's good to be with you.
We'll probably cover some ground off the top that you've already covered, but these seem to be points of concern that some people have had about the movement, it seems, of trauma intensivity, and maybe that's the wrong word, the intensive trauma care, out of Sullivan County to Johnson City, when some people say Kingsport maybe is even more central for our overall geographic region. Why move to Johnson City what's in Kingsport and Bristol?
Well, most of the trauma is going to stay in either Holston Valley or at Bristol. 65% of the trauma is orthopedic, 20% is neurosurgery, and we're going to continue to provide those services there. So most trauma is going to stay at Holston Valley or at Bristol. So what we're really talking about, there was only 380 major trauma cases between Johnson City and Kingsport last year. And that's an objective metric. Major trauma is coded by doctors. And of that major trauma, 150 cases were at Holston Valley and 220 cases were at Johnson City Medical Center. So about 60% of the major trauma today is provided at Johnson City Medical Center. So we're really only talking about basically about 150 to 200 major trauma cases. All of the national evidence, all of the recommendations from virtually every expert says major trauma that's consolidated in one institution has better outcomes. And I would encourage people to read about that because it's very important. We're talking about the most major trauma cases. If you're in a car accident or if you fall, if you have a hip fracture or something like that, you're still going to be able to get your care at the closest hospital to you. And that's something that's very important. I want to reiterate, most injuries are going to continue to be treated where they're treated today. And I should also add, heart attacks, strokes, other types of regular emergencies that are serious, you can still go to your local emergency department. That's not considered trauma.
Alan, right after this decision was announced Wednesday, the Sullivan County Commission met Thursday and passed a resolution opposing this measure, which you know about. One of the commissioners told us this change in trauma services, he said, lives will be lost. I think the mortality rate will go up. I think the death rate will rise in Sullivan County. Is that mistaken? Is that incorrect, or is that true? Well,
first of all, I appreciate the partnership we have with the Sullivan County Commission. I look forward to actually meeting with them. They don't have the information that we have, and so I think once they have it, I think their opinion will be different. To the contrary, more lives will be saved. This will improve the outcomes for people because the evidence shows major trauma should not be diluted into two lower volume centers. It should be done at a place where you'd have more volume, more consistency, more consistent coverage of doctors and staff. So it's the right thing to do. I think all of the evidence points to the fact that this will improve the care and the outcomes for people. Now, if that commissioner that said that has evidence to the contrary, we would certainly want to hear that. But so far, we've seen no evidence to the contrary. Keep in mind that this decision was not just made, I didn't actually make this decision. We had a committee of physicians, including trauma surgeons, general surgeons, the former president of the Tennessee Medical Association, doctors contributed to this decision. And then our board made the ultimate decision. So
you talk about the information that they didn't have. The commissioners passed the resolution and in essence said they were blindsided, that they had not been brought into the discussion. They found out when the announcement was made. Is that true? Was there no discussion with local leaders about this plan to realign trauma?
Well, our board made a decision Monday, and we did reach out to several elected folks in Kingsport and at least one of the leaders on the county commission in Sullivan County. There wasn't enough time to get to all of them individually. There's 24 of them. But what we said at the press conference on Wednesday was, we're announcing what our intentions are for the trauma centers. Now, this begins a one-year process of working with local governments to put together a regional trauma system. A big part of this is, you know, we have patients that go to some of our rural hospitals throughout the region, and they can wait hours before being transferred because of the unavailability of ambulances. There's a need to create more coordination between all of our counties with pre-hospital transport. That's why we've offered to spend money to create a pre-hospital communication system so that, for instance, if there's an ambulance in a rural community that needs to transport a patient, by communicating with us, we can coordinate with other EMS services and then provide coverage for that ambulance while they're traveling. But this, you have to start with announcing what our vision is, then you start meeting with the county commissions and everybody else to reach agreement on what that system should look like.
Another topic that has generated some questions has been the realignment of neonatal intensive care. We're going to take a brief break and come back. Our discussion with Alan Levine about changes with the Ballad Health merger continue right after this.